saved a lot of heartache later. Thank you so much. Let me just submit some folks here. Okay, great. So welcome to today's special live stream of the When Science Speaks podcast. I'm Mark Bayer. I host the podcast. It's great to have you here. Today's podcast is, please mute yourself. Today's podcast is brought to you by Bayer Strategic Consulting in Washington, D.C., which is my consulting firm, helping scientists and engineers get funding, gain influence, and build relationships with their most important stakeholders. And I am just so thrilled that we have these two incredible researchers here with us to talk about something it's been the #1 issue for over a year here, and their important article has just come out in Vaccine, the journal Vaccine, and I want to read the intros for both Dr. Amy Burke-Garcia. She's an award-winning digital health communicator and researcher with nearly 20 years of experience. Amelia is currently leading a national communication initiative. It's called How Right Now. It's funded by the CDC Foundation in collaboration with the Centers for Disease Control and Prevention that aims to increase coping and resiliency and reduce adverse psychological and behavioral outcomes amidst and as a result of the COVID-19 pandemic. Amelia served as director for CDC's National Influenza Vaccination Campaign, and prior to that, she directed digital strategy for CDC's entire immunization portfolio. She's also author of the book Influencing Health, a comprehensive guide to working with online influencers, which was published in 2019. It's a great book. I read it when it came out. Amelia is a member of the editorial board for Social Marketing Quarterly Journal and the scientific committee for Big Surf 20. She's been named as Diverse Health Hub's Women of the Week and to verywellhealth.com's list of 10 modern female innovators shaking up healthcare. Amelia earned her PhD in communication from George Mason University and master's degree from Georgetown University, bachelor's from McGill University. Dr. Amy Leader, it is great to have her on the show today. Amy is an associate professor in the Division of Population Science at the Department of Medical Oncology at Thomas Jefferson University. Amy's a behavioral scientist. She's also a full research member and the associate director of community integration at the Sidney Kimmel Cancer Center at Jefferson. And she also teaches courses in the Master of Public Health program at Jefferson's College of Population Health. At the Kimmel Center, Amy oversees and coordinates community outreach efforts, and she founded and she currently chairs the Community Advisory Board, which is comprised of a rotating group of organizational leaders representing priority populations and regions in the greater Philadelphia area. Amy is the principal investigator of an NCI-funded study that aims to integrate local community members into the research program at the Cancer Center. She also serves on the Strategic Leadership Cancer Control Task Force for the Pennsylvania Department of Health and co-founded the Greater Philadelphia HPV Immunization Collaborative. Amy was recently elected as the 2021 chair of the Cancer Special Interest Group at the Society of Behavioral Medicine. So I have questions prepared for both Dr. Burke-Garcia and Dr. Leader. And then I would encourage you to put questions that you may have into the chat. And so as soon as we are done with the prepared questions, the questions that I have, then I will ask the questions in the chat in the order in which they were received. So let's go right to the question. So the first question I have for both of you, and maybe Amelia, you can start out here, is what led you to start this research, to initiate the research in the first place, which started a while ago, obviously.
Yeah, thanks, Mark. Thanks so much for having us here today, and thanks to all of the attendees. I think that the findings from this study emerged out of sort of two areas that I think Dr. Leader and I are both really passionate about and have done a lot of work in. I've worked in the vaccine communication space for many years, and in particular have had a focus on digital media and online influencers and their ability to persuade and share information with their readers. And so together with Dr. Leader's background and experience in vaccination, we started talking you're right, a while ago about the opportunity to collaborate and bring both of our interest areas together and to better understand not just how social media influencers can influence the vaccination conversation, but in particular, knowing that a lot of the vaccine hesitant conversation happens online and in social media, we wanted to better understand both how do you get access to understand the folks that are sharing these messages, and then what are their perceptions, what are their beliefs and knowledge around vaccination? Do they differ from other populations? And so that's how we started kind of crafting the study aims early on. And then we're lucky to get to work on this together last year.
Great. Yeah. Amy, is there anything that you'd like to add to that?
No, I think that's great. But I think the reason that I loved working with Amelia is, in the public health world, it's very polarizing. There's the public health professionals who are very in favor of vaccine, and then there's this community that's not. And it's like, there's this big wall between us. And I was always fascinated. Could we just talk to them? Could we break down this wall and really get into understanding what their thoughts and motivation was? And Dr. Burke-Garcia had access to that community. And so it was just a really natural fit to break that down.
Yeah, for sure. And of course, your article is an important contribution to trying to do that at the precise moment that we really, really need it. I'm wondering, and maybe Amy, you could start with this. Was there anything about the research that surprised you? Any of the results of the findings that you weren't expecting?
Yeah, I think there were a couple. I'll start off with one, and then maybe Amelia, you can chime in there too. So we interviewed 15 online influencer mommy bloggers for their thoughts, views, and understandings, as Amelia was saying. And I think there were a couple things that was interesting to me. One, maybe not relevant to vaccination, but I felt like the mothers were tired of this victimization role that they were in, that people thought they were, these bad mothers, that the public health thought, well, if you don't vaccinate, you must not value your children. And that's actually quite the opposite. They have taken the stance, I think, in a sense, because they do really value the health of their children, and they truly feel like they're making the right decision. So I think there were many interesting findings that came out of the study, but that was one. Because I had never had the opportunity to talk to them, I really didn't have an understanding of what they were thinking. But we may be on the same page more than we think, except for this, one issue about how it divides us.
Interesting. What about you, Amelia? Any thoughts?
Yes, I think one of the main takeaways that I learned through this research has to do with the influence of new technology and the vaccine hesitant message. We heard from a couple of the influencers that we interviewed, whom we interviewed, that there is, of course, confirmation bias happening with their selection of provider and the selection of their news sources. In short, they look for evidence that helps support some of their beliefs. However, one of the really interesting trends that we heard about that I hadn't heard anywhere else was the use of emerging technologies like genetic testing technology, like the 23andMe's or the Ancestries of the world. And the use of these to actually obtain genetic samples and then have them tested either by a medical professional or a third-party app. And then the results of those tests lead to findings for them that suggest that there is a genetic predisposition for vaccine injury. I'd never heard this. I don't think Dr. Leader had heard this before, but this for me is a marker of sort of the wild, wild west of the vaccine hesitant discussion. It's a space where I think public health has struggled to sort of wrap our arms around how do we talk with these communities, how do we message to these communities, how do we better understand their real fears, their cultural perspectives, their lived experiences. And I think the use of this technology is pushing that debate farther, and it's going to make the challenge of working together with vaccine hesitant communities that much harder. Well,
I mean, I really think, just that finding, uncovering that people are using services like 23andMe, I mean, that's an important fact for public health and messaging and public health messaging to be aware of, to investigate that further for sure. I'd like to ask you about this, and Amelia, as you both point out in the article, the WHO has identified vaccine hesitancy as a top threat to global health, and I'm wondering if your research findings make you more or less concerned, not just, not as an academic, as a researcher, but as a human, on a human level. Are you more concerned or less about the chances for success of future public health efforts involving vaccinations, like the massive one that we have underway right now?
So it is a big concern. As a human, as an individual, I definitely worry about our ability to communicate with the majority of people and make sure that we're sharing the benefits of vaccination and vaccination as a tool in the prevention toolkit. I also worry about our ability to recognize various cultural contexts that people are coming to this discussion with. So it does worry me, but I also know that I've interacted with, over the course of my career and continue to do so, a number of people who are supporters of vaccination and who are willing to talk about it and to share their personal fears and stories, and to show empathy to others who may have questions. And I think that gives me hope. This idea of having a multifaceted communications outreach strategy that includes a number of different thought leaders and trusted individuals to share those messages. That to me gives me hope that we can continue to this conversation. I don't think it's a place where we'll ever overcome it entirely, but to continue the conversation and to continue to share these messages in effective ways.
Yeah. Thank you. Anything that you'd like to add, Amy?
I agree. I think as public health people, we have to remain hopeful and optimistic. I mean, this is what we do. This is how we try and help communities. But long before I was doing vaccine research, generations before me, the thought was, well, we just have to personalize the risk. For people who aren't taking these vaccines, they don't feel this personalized risk to the problem. But I even saw data this morning that said among people who know someone who died of COVID, the number of people who aren't going to get vaccinated was like 40%. And that is having a personal knowledge of someone who died of COVID. So those old thoughts about, we just need to personalize the risk. We're in a different era, as Amelia was alluding to. We have to really use some of these new tools that we have, but I remain hopeful. Yeah.
Thank you. I think you both sort of touched upon this, but just specifically looking at the rollout of the COVID vaccination project, wondering what lessons from your research, that's explained in the journal article, what lessons should policymakers pay particular attention to as we continue to implement this program? Do you want to start with that? You want to start, Amelia, and then turn it and ask for Amy?
Sure. So I think based on the research that Dr. Leader and I conducted, there are probably a couple of main implications. I think the first has to do with leveraging trusted voices, leveraging a variety of those. So we focused on social media influencers in this particular study, but I think it has ramifications to other community leaders, and that varies based on who you're talking with. I also think that having a multifaceted communications outreach strategy is really important. There's a lot of data in prior literature that suggests the role of the provider as being quite pertinent to vaccine decision-making. And that, of course, is paramount. And there are early guidelines that have been released around healthcare provider recommendations on the COVID vaccine. Having said that, I think we have to also recognize that people are influenced by a variety of people and factors, and we saw that in our study. And so leveraging different types of voices and different types of communication channels, I think, will be really important.
It's like personalized medicine. We need personalized messengers to talk about the medicine. Amy, please go ahead and add your thoughts.
No, Amelia is absolutely right. The two pieces of the puzzle I think we found were the personalized messengers and then the personalized messages. And so, as Amelia was alluding to, there's going to be various reasons that people are vaccine hesitant, and we need to make sure we have multiple messages and messengers to meet everyone's need and to keep those messages and messengers going for a while. I mean, not everyone is going to make this decision the moment they have access to the vaccine. And so people may think about it, they may talk to friends, they may wait to see if their neighbors get it, they may consult somebody. And so we're going to have to keep this up for a while.
Yeah, absolutely. Such a great point. I want to talk a little bit more about the messages themselves and start with you, Amy. This has been an issue since, as long as I've been looking, at this. And, you point out in your article that anti-vaccine messages receive much more attention across social channels than positive messages about vaccines, which aren't as likely to go viral, so to speak. So, why do you think that is?
The anti-vaccine movement has done a wonderful job with being able to tell stories about what their passions and their views are. And so they may show images on Instagram or other social media platforms of children who are passing out, or having adverse reactions, or these very dramatic scenes around adverse injuries of vaccines. And that's very like sort of tugs at your heart, and you want to listen and you want to know more, and we empathize, and there's that narrative transportation that goes on. And then the public health community comes out and says, this vaccine is 95% efficacious. And it just kind of sits there. And so largely that reason, we need to do a better job at being able to tell stories with our data. Amelia, do you have more to add?
Oh, yeah. So there's actually some data that suggests why falsehoods spread faster, deeper, wider, more quickly than truths, and that has to do with the sort of novelty of it, right? It's sort of sensational, and I think it oftentimes takes the form of stories and stories about people that sort of make people believe and want to share them. And I think that Amy's absolutely right. I think that we in public health, we have often relied on data and this idea of awareness and education as being sort of fundamental to the vaccine conversation, but it extends to a number of other topics. And I think in the world of how people make decisions, data and awareness are only part of the equation, and there are a lot of other influences. And I think that finding ways to personalize it, to tell stories of the opportunity for vaccines to be helpful in certain circumstances is really, really important.
Yeah, for sure. And it's funny because as a sort of persuasion nerd, I've seen this. This goes back to like the earliest writings of just falsehoods flying while the truth goes limping after it, is what Jonathan Swift said. And he wrote that in 1700. And he wasn't the first person. There is reference in classical literature about this as well, as how falsehoods just are much faster move much faster through the population than the truth actually does. One of the interviewees, and this is from your report, from the article, one of the interviewees said, there was never any framing of vaccinations in a negative light growing up. It was just something that you did. And I'm wondering, Amelia, maybe you could start us off, why the change in messages and attitudes about vaccinations, in your view?
I think that it's a media information access, and we heard that a lot. That the folks that we interviewed as part of our study participate actively in social media and communities. many of them were fully vaccinated themselves as children, and even in some cases fully vaccinated their older children, and over time reduced the number of vaccines they were giving their subsequent children, to the point of some of their younger children not being vaccinated at all. And I do think that has evolved out of exposure to different types of information, and that has largely come, I think, through the internet and social media. And I think that the advent of the internet and social media has really allowed for people to be exposed to different people, different worldviews, different information. And those are all really great things. I think it has also meant that misinformation has had a chance to spread through those same channels.
Mm-hmm. Amy, what would something to add?
No, I absolutely agree. She's spot on. Yep.
It's just interesting. One of your interviewees also mentions, I was thinking back to the article, like we used to have like 3 vaccines and now it's like 20, and so, maybe in a family where there are multiple children, different ages, the vaccination happens when the first kid is born, second or whatever. And then, by the time the maybe third or even fourth child is born, there are just even also a lot more vaccines. And it kind of like maybe leads you to wonder, like, why so many vaccines, when the oldest boy, just had 4 vaccines, and why is our youngest now have like 15 different vaccines? Must be the pharmaceutical company in collusion with the government. And that was some of the information that came out in your article that you noted as well. I also want to get to this really interesting point in your article. You write about individual decisions about vaccinations that affect families compared to how those decisions are made with respect to communities. How vaccination decisions affect families versus how vaccination decisions could affect entire communities. And I'd like you to elaborate on that, because I'm wondering, how might a similar attitude also affect mask wearing, which, at the time, we were initially told that mask would help, maybe not protect you, but they would help protect other people that you might be walking by or come in contact with. And that dichotomy between the two is just really interesting. And I hadn't seen that in a lot of places. So maybe, Amy, maybe you could start out with that.
Yeah, that was an interesting finding that in our study, is that at least with the mothers that we spoke with, they were very centered on their family, their own children. And so those very classic and typical messages of herd immunity and doing this for your community and altruistic benefits for people you don't know, they didn't resonate with them, because they really were, child-centric, family-centric, individual, centric person. And so we have to think about shifting those messages to resonate with them. And you're right, we were talking earlier with Amelia about how we're seeing this play out in mask wearing. And I remember some of those very early messages was actually like, my mask protects you and your mask protects me. It wasn't about wearing it for myself. And I think we slowly moved away from some of those to get closer to individual protection, maybe, household, that high level risk. But I don't know if those messages resonate as much as they used to. Some of it's a culture shift too. It's just who we are as Americans.
Right. Not too encouraging there. Amelia, would you like to add to Amy and chime in here?
Yeah, I think Amy is correct. We didn't look at mask wearing. Of course, the study happened before COVID, but the finding around the individual versus the community and the importance of the individual or the family over the community was, I think it's very indicative of sort of a larger cultural shift that has taken place. I wouldn't even say recently, it's probably happened over a number of years. And so I think it's just very telling, and it also speaks to those new messages and new messengers that we need to find in order to be able to help people understand the benefits of vaccination. In particular, tailoring those messages to, if it's important to the individual, then that might be the best way to communicate the value.
Yeah, and so this is really the last prepared question that I have coming up, and then we'll get to questions that participants may have. For those of you who are on the live stream, please put your questions in the chat. I will unmute you. I'll go in the order in which they were entered into the chat. And before you ask the question, if you could just identify yourself and the outlet that you're with. So my last question is sort of wraps up a lot of elements that both of you have talked about. And that's really, looking at the current campaign to inoculate against COVID, knowing what you do about vaccine hesitant or refusing social media influencers. If you had like 2 minutes with policymakers, people, health professionals, people who are, involved in developing and implementing the COVID vaccination program, what would you tell them to do and not to do? Amy, do you want to start off with that?
Yeah, well, some of the other research that I've worked on with teammates and colleagues is we think that the social media landscape is just overflowing with anti-vaccine influencers. But the reality is there's a lot of people out there who are still putting out pro-vaccine content. And so I would suggest that policymakers, whether health departments, whoever is involved in this rollout, partner with people who are willing to post messages that are tailored to their community, that resonate with their community. On their spaces. I mean, as Amelia was alluding to, we're going to need lots of messages in different frames and different formats, but there are people who are willing to talk about this. It's not just a landscape of anti-vaccine commenters, and so to find those people. And I think we also learned in our work, Amelia, is to create polarizing messages. Let's not, we don't need more divisiveness in the world. We don't need to pit one against another in the world. We need to acknowledge that there's hesitancy. We need to acknowledge that there's generations and decades of very valid and deep-rooted beliefs and understanding about vaccination. And we need to acknowledge that and to bring that into the messaging.
Yeah, so important, the emotional aspect of this. And, whatever you think about, arguing with people or whatever, it doesn't work anyway, actually. It makes things worse. So if from a practical level, not a good idea either.
From the influencers, one of the questions we asked in our interview guide was, what would be one thing that you wish the pro-vaccine movement would talk to you or tell you about? And they just said, just please stop. Please stop with the polarization. We all care about our children. And in this context, we're all trying to make the right decision. We're all coming out of a pandemic. We've all been through a lot. Let's try and find some common ground, acknowledge everyone's understandings and hesitancies, and let's just help people get through this.
Great. I mean, I'd love to get your thoughts.
Yeah, I think what we found in the research really had to do with understanding that these social media influencers who were choosing not to vaccinate, and in many cases sharing those beliefs in social media, they're regular people like you and me, living with families with various types of issues, health issues, challenges that they're facing every day, and they're trying to make the right decision for their family. And so the idea that they are trying to sabotage community health in some way is not real in their minds. That's not what their intention is. Their intention is to make the best decision that they possibly can. So I think, and it's harkening back to something I said earlier, which is we need to speak with empathy. We need to address and allow people to express their fears and their worries. I think we have to listen, and we have to understand the cultural context and the lived experiences that people come to this discussion with in order to be able to understand what it is they're going through and be able to message to them in a way that can be effective in getting them to both understand the value of the COVID-19 vaccine as well as any other vaccine, and hopefully encourage uptake. So I think that we need both a better understanding, as well as we should also be looking for those trusted voices and individuals to work through.
So important. Thank you for that. I do not see any questions right now in the chat. If you do have a question, please put it in the chat, or you can go ahead, unmute yourself, and identify yourself, your outlet, and ask our panelists here, Dr. Burke-Garcia and Dr. Leader, your question. We're also recording this, so if you would like to receive a link to the recording, you can go ahead and put your email or the email that you want the recording sent to in the chat, and we'll make sure you get a link to this afternoon's recording.
Hi,
Okay.
this is Amy Birnbaum from CBS News. I just had a question about the different demographic that seems to be emerging in the vaccine hesitancy beyond, who we know are anti-vaccination. So who do you see as the demographics of people who are worried about this vaccine? And then as a sort of follow-up, just given the fact that really the crowning achievement of the current administration is the rollout of this vaccine and its speed, why do you think there's, one recent poll showed more, maybe 40% of Republicans were hesitant, or of the people who were hesitant, 40% were Republicans. Why do you think that is?
Amelia, do you want to go? Do you want me to go?
So I would say, again, based on the research in this study, I'm not able to address the second question. I think the demographics of people who are, I think that you're touching on two different but related points here. One is being hesitant, and the other is being particularly worried about the COVID vaccine and the context within which the COVID vaccine has rolled out, which is unique, right? I think the fastest vaccine besides the COVID-19 vaccine that has rolled out, it was the measles vaccine, I believe. And I think that happened in about it took 4 years to come to market. So I think what we're seeing is both this mix of people who are vaccine hesitant and who across the spectrum may be vaccine hesitant. And then there may also be people who are worried just in particular about this vaccine because it has come to market quickly. We didn't study this as part of our study, so all I will do is sort of draw on what we found in our study, which is to say that I think that the vaccine hesitant community tends to be similar. They tend to be sort of more well-educated, of sort of a higher income. Having said that, though, those are people who are making decisions not to vaccinate. There are also issues relating to distrust of the government, distrust in the research process. And you find that a lot in communities of color where there has just been many years of sort of not poor scientific processes and involving those communities in the research process. And so I think that there are a number of factors that play into this. We focused on the non-vaccinating social media influencers that fall into sort of that first category. Amy, I don't know if you want to add to that.
Yeah, so I think too, Amelia, there's a little difference in the vaccine that we were studying, which was largely about vaccinating your children. And for COVID, we're largely thinking about vaccinating yourself. So there's definitely parallels, but there's some nuances there. So the demographic, we were speaking to mothers about children as opposed to like a population level rollout. So I think there's some demographic differences there as well. But I think there's vaccine hesitancy everywhere, in every demographic, in every age group, in every racial group, in every community, in every political party. And I think just because you aligned with a particular administration, now I'm not a political scientist in any way, but just because you align with an administration, I don't think always aligns with vaccine views. I think they're very different. One's a health decision, the other one is a bigger political decision. But I think we have to assume that there's vaccine questioning people everywhere, and more so in certain demographics than others that Amelia was alluding to. But I think they're by and large, this is a quick rollout, as you mentioned. So people will be maybe not necessarily hesitant, but certainly questioning.
Right. Are there any other questions from participants? Okay, well, thanks both to our panelists for being here. Thanks, Dr. Amelia Burke-Garcia, Dr. Amy Leader. Thank you for putting out this, doing the research on this such important, landmark, monumental, historic topic. And the fact that it's coming out this week is a nice coincidence, perhaps.